Chairman, thank you. Members of the committee, thank you. I'm Dr. Dave Dunkle, President and CEO of Johnson Memorial Health, which is located walking distance, a beautiful downtown of Franklin, Indiana. So thank you for letting me be here today. I'm here to represent Indiana Hospital Association, and though we support the intent of Representative Carball's bill, we also want to raise a few points for consideration. As I stated, we're supportive of the bill and the intent behind the components of the bill, such as one, nonprofit hospitals' community benefit being greater in their state tax exemption, two, ensuring hospitals are teaching the next generation of practitioners through preceptors, and three, providing greater transparency of hospitals' payment assistance plans. With regard to the community benefit portion, a study conducted by EY confirmed Indiana's nonprofit hospitals provide $3.9 billion in total benefit to their communities, which far exceeds the value of their tax exemptions by $2.3 billion. In other words, the total benefit that Indiana's nonprofit hospitals provide their communities is nearly 2.5 times the tax exemptions they receive. However, there's a separate bill moving the Senate right now, Senate Bill 173, that passed out of the Senate Health last week that would limit what counts for community benefit for purpose of state law. If we are limiting what counts for community benefit in one bill, we should not also be requiring hospitals to certify their community benefit exceeds their state tax exemptions in another bill at the same time. Further, we feel very confident that Indiana nonprofit hospitals are fulfilling their charitable missions, but I also want to note that many hospitals, particularly small and rural hospitals, I would consider myself a smaller hospital, have likely not calculated their state tax exemption for many years. An approach could be to allow each hospital to calculate their exemptions over the next year moving forward on this issue, but ultimately, we would ask you to determine what you want to see in this community benefit space and work with us on that, rather than pulling us in two different directions in 173 and 1335. Hospitals are also committed to encouraging practitioners to serve as preceptors to ensure the next generation of practitioners are trained appropriately. However, we do not know whether 100% of every small and rural hospital has preceptors in 60% of their clinical departments at all times. Indiana's Rural Health Transformation Program will work on this issue by incentivizing preceptors in rural hospitals, but it may be premature to require that specific 60% requirement. And I can tell you from a hospital, again, Johnson County, we have great access to Franklin College and physician assistant students. We take medical students from IU, from Marion. We struggle with what's called preceptor fatigue. I mean, we don't have preceptors in every department. We have, we don't employ every specialty, and that's going to be the case for many hospitals in the state. And again, we are, if you saw the map when the good Dr. Weaver presented earlier, we are not rural enough to qualify for transformation funds. So it would be a great strain on organizations like ours. But again, we want to teach the next generation. There's not enough physicians, not enough physician assistants, there's not enough nurses. So we are very willing. With regard to the payment assistant provisions, Indiana Hospital Association is working with Representative McGuire on that language in House Bill 1271 and appreciate all the work that has gone into that to date. Before I close, I just want to reiterate that we are not opposed to new standards or transparency, but at a time when the legislature has asked nonprofit hospitals to be hyper-focused on affordability and providing high-quality patient care, we want to ensure you that any new requirements further these goals. And to provide you with some context, the following is a non-exhaustive list of the current reports and data sets that nonprofit hospitals have to provide to the state each year. An audited financial statement, a Medicare cost report, a separate hospital fiscal report, payment service on a quarterly basis, a patient service, report on a quarterly basis, Schedule H and worksheets, annual community benefit report, hospital's most recent community needs assessment, a direct-to-employer arrangement audit, medical error reports, trauma registry, 340B transparency, site of service lists, and pricing lists. And this doesn't include everything else we have to give to the federal agencies. Just saying that it's a lot of reporting, and again, a lot of hospitals like mine, we don't have a lot of excess labor, and it's tight. So it's just ask us to report more and more and more. It just gets to be onerous. But thank you for the opportunity to testify, and I look forward to working with Representative Carball on the bill. Thank you very much.